Welcome to Healthy Habits. We are so glad you found us. Here at Healthy Habits, we are dedicated to helping you live your healthiest and happiest life. Our channel is all about sharing practical tips and advice for improving your nutrition, staying active, and maintaining a healthy lifestyle. Whether you're looking to lose weight, boost your energy levels, or just feel better overall, we've got you covered. Our team of experts will provide you with the latest research and recommendations for living a healthier life. So join us on this journey to better health and wellness. Subscribe to our channel and hit the notification bell to stay updated on all of our latest videos. We can't wait to share our healthy habits with you.
The early warning signs of heart failure you need to know. Cardiovascular disease is a leading cause of death and disability worldwide. According to data from the American Heart Association, AHA, cardiovascular disease is among the leading causes of death in the United States, accounting for about 697,000 people in the United States who died from heart disease in 2020. That's 1 in every 5 deaths. This includes conditions such as coronary artery disease, heart failure, stroke, and hypertension. The AHA estimates that about half of all cardiovascular deaths are due to coronary artery disease, which occurs when the arteries that supply blood to the heart become narrowed or blocked. Coronary heart disease is the most common type of heart disease, killing 382,820 people in 2020. One person dies every 34 seconds in the United States from cardiovascular disease. Heart disease costs the United States about $229 billion each year from 2017 to 2018. This includes the cost of healthcare services, medicines, and lost productivity due to death. In this comprehensive video we will provide valuable tips on what to look out for to prevent heart problems and to maintain optimal cardiovascular health. Consider sharing this information with your friends and family to help protect their heart health. Visible signs that may indicate a heart problem. Swelling edema. Edema is the medical term for swelling that is caused by excess fluid accumulation in the body. It can occur in any part of the body, but is most commonly seen in the feet, ankles, and legs. Cardiovascular disease, which includes conditions such as coronary artery disease, heart failure, and stroke, can cause edema by disrupting the normal circulation of blood and lymph in the body. For example, in heart failure, the heart may not be able to pump blood effectively, causing fluid to build up in the legs and other parts of the body. Edema can also occur as a result of damage to the veins or lymphatic vessels, which can cause fluid to leak out into the surrounding tissues by blockages in the arteries of the legs. Chest pain or discomfort. This is a common symptom of a heart attack, which is a serious and potentially life-threatening cardiovascular event. A heart attack occurs when the blood flow to the heart is blocked, usually due to a buildup of plaque in the coronary arteries. This can cause damage to the heart muscle and can be life-threatening if not treated promptly. Shortness of breath. This can be a sign of a heart problem, especially if it is accompanied by other symptoms such as chest pain or discomfort, nausea, vomiting, or dizziness. One possible cause of shortness of breath is heart failure, which occurs when the heart is unable to pump enough blood to meet the body's needs. Heart failure can cause fluid to build up in the lungs, leading to shortness of breath. Fatigue. This can be a sign of a heart problem, especially if it is accompanied by other symptoms such as shortness of breath, chest pain or discomfort, or swelling in the ankles, feet, or legs. One possible cause of fatigue is heart failure, which occurs when the heart is unable to pump enough blood to meet the body's needs. This can cause the body to become fatigued as it struggles to get enough oxygen and nutrients to the cells and tissues. A rapid or irregular pulse. This can be a sign of a cardiovascular problem. It can be caused by a variety of factors, including heart arrhythmias, an overactive thyroid gland, dehydration, and certain medications. In some cases, a rapid or irregular pulse can be a sign of a more serious condition, such as a heart attack or stroke. High cholesterol. Cholesterol is a fatty substance found in a number of foods, and is also made by your liver. High cholesterol can contribute to plaque in the arteries. One of the ways you can lower your cholesterol is by eating a healthy diet. Your physician may prescribe medications to treat cholesterol that also lower your risk of heart attack. Talk to your cardiologist about heart-healthy foods and monitoring your cholesterol to reduce chances of heart disease. One of the best ways to manage your cholesterol is by avoiding foods that increase your cholesterol levels. Bluish skin, also known as cyanosis. This can be a sign of poor cardiovascular health. Cyanosis is caused by a lack of oxygen in the blood, which can be due to a variety of cardiovascular problems such as heart failure, pulmonary embolism, or a congenital heart defect. Eruptive xanthoma. This is a skin condition that is characterized by the sudden appearance of yellowish, raised bumps on the skin. It is often associated with high levels of triglycerides in the blood, which can be a risk factor for cardiovascular disease. If you have eruptive xanthoma, it is important to have your triglyceride levels checked and to work with your healthcare provider to manage your risk of cardiovascular disease. Upset stomach. This is one heart-related symptom that is not as common as chest pain as an upset stomach, which might manifest as a stomach ache, vomiting or acidity. Since these symptoms are generally associated with the flu or stomach infection, they get overlooked when it comes to heart disease. However, if you believe that your last meal should not have led to these symptoms, then it is important to get medical attention. Remember that women have a greater chance of experiencing an upset stomach in relation to heart disease. Persistent cough. A persistent cough doesn't always mean your heart has a problem, because it's a common symptom of many things like a cold, the flu, and bronchitis. A never-ending cough can be fluid building up in your lungs, which is a sign of congestive heart failure. When the heart is not able to pump efficiently, blood can back up into the veins that take blood through the lungs. As the pressure in these blood vessels increases, fluid is pushed into the lungs. The cough is caused by the irritation and fluid, which is similar to shortness of breath. Random cold sweats. Sweating is a natural, healthy function the body goes through to cool itself down. However, cold sweats could mean a problem with your heart when you're not doing anything physical, particularly when there's chest pain along with it. The sweat may come from your body trying to cool down the inflammation around the heart. Leg pain. General achiness or a cramping sensation in your legs can be a sign of peripheral artery disease, PAD. It's a form of cardiovascular disease that's characterized by constricted blood flow to the extremities including your arms and legs. Often, the pain will occur during physical activity and subside with rest. PAD is more common in smokers and people with diabetes. Sleep apnea. Sleep apnea is a condition in which your breathing stops and restarts intermittently during sleep. It is commonly associated with snoring, but not every case of sleep apnea coincides with snoring, and not everyone who snores has sleep apnea. It can be a damaging sleep condition, leading to prediabetes or heart disease. Many conditions can cause sleep apnea, including age, obesity, diabetes, and abuse of alcohol or some prescription drugs. However, it could also be caused by heart failure, which could hamper brain function like the involuntary breathing reflex. It's important to note that not all people with heart disease experience these symptoms, and some people with these symptoms may not have heart disease. If you are concerned about your heart health, it is important to speak with a healthcare professional for a proper diagnosis and treatment plan.
Thank you for watching this video on healthy habits. We hope you found the information helpful and are motivated to make positive changes in your own health and wellness journey. Don't forget to subscribe to our channel and hit the notification bell to stay up to date on all of our latest videos. We post new content every week, so there's always something new and exciting to learn. If you have any questions or comments, feel free to leave them in the comments section below. We love hearing from our viewers and always do our best to respond to your comments. Thanks again for watching, and we'll see you in the next video.